Welcome back. For the first time, firefighters in Appleton have the opportunity to be screened for esophageal pre-cancer.
This test aims to spot potential warning signs for workers in a job really known to carry this higher cancer risk. Maria Parmigiani finds out how it could help.
The team behind Monday's testing at Appleton Fire Department say it's early detection that can be life-saving, and there's a reason firefighters are taking advantage.
Due to the fact that firefighters are at a higher risk for cancer than the general population.
This testing focuses on esophageal precancer, with 80 firefighters and retired members taking part.
Cancer is just in everything, so when something starts on fire, that's what we're breathing and that's what we're getting exposed to.
Brittany Cubis, the nurse administering the test, says it's meant to spot changes before the disease turns deadly. The sample takes about 5 minutes to collect, with results in about 3 weeks. If results are positive, firefighters follow up with their own providers for additional testing. Cubis says the higher risk is tied to the hazards firefighters face on the job.
They're at a 62% higher chance of developing esophageal cancer. They put themselves in harm's way, and the amount of toxins that they breathe in on a regular basis with their job, unfortunately, is what puts them at such a higher risk. So anything we can do to give back to them and help them get these pre-cancer screenings is so very important.
Department leaders say this kind of screening could become more common as cancer concerns in the firefighter community continue.
I think cancer screenings are going to become more normal in the fire service because the rates of cancer have not decreased at all. So, and the things that we're burning today are different than the things that they burned 25 years ago. So everything's made of plastic, and the chemicals that they're putting off when they start on fire is way more carcinogenic than what we had 30 years ago. So the cancer rates are not going to change. They're only going to go up from here.
The American Cancer Society says risk factors for this type of cancer include things like tobacco and alcohol use and acid reflux. 9 out of 10 cases are found in people 55 and older, and men are more likely to get sick than women. Representatives with Lucid Diagnostics, which ran the testing, say you should talk to your primary care provider if you fit as few as 3 of these risk factors. In Appleton, Maria Parmigiani, Action 2 News.